Hello, this is Dr. Craig Tanio with Rezilir Health, and today we are going to discuss hyperbaric oxygen therapy. We have two Fortius 420 hyperbaric oxygen chambers from OxyHealth. These chambers are used to follow the latest protocols for brain health, fatiguing illnesses, wound healing, and inflammatory conditions. What happens during hyperbaric oxygen therapy? Patients go inside a chamber for 60 to 90 minutes. There are two things that happen during this time. Patients get higher atmospheric pressure, equivalent to doing a dive underwater, and patients get higher amounts of oxygen. Patients breathe oxygen through a mask, which comes in through an oxygen concentrator. The mask allows us to do what is called an air break, which is that every 20 minutes, patients will take the oxygen mask off and take a 5-minute break from breathing pure oxygen and just breathe room air. This helps the body become more sensitive to oxygen, which is often known as the hyperoxia-hypoxia paradox. An additional benefit to the mask in that there is no fire hazard inside the chamber. As a result, patients can be comfortable inside the hyperbaric chamber, read a book, an iPad, or listen to music. Some patients will also get light therapy inside the chamber if medically indicated. Our hard chambers can go between 1.3 to 2.2 atmospheres. Neurologic protocols are usually between 1.5 and 2 atmospheres. However, many of our patients with inflammatory conditions can be very sensitive to pressure, and in these cases we will take longer to do a dive, and oftentimes we will cap the amount of pressure that patients will receive. In these cases, more pressure is not always better. There is a technician on site at Rezilir all times, and you can communicate with the tech via a walkie-talkie. What is the data on hyperbaric oxygen? We are going to devote a future video to understanding some of the complex research issues involved in studying hyperbaric oxygen in neurologic patients. However, let me highlight two important recent papers. Both of them come out of Israel. The first paper is on healthy older adults and cognitive function. When the Israelis looked at a protocol where patients received hyperbaric oxygen up to 2 atmospheres for 40 to 60 sessions, those patients had improvement in information processing speed, attention, and executive function. In addition, the Israelis looked at cerebral blood flow and saw that there was improvement in the appropriate parts of the brain associated with those functions. The second paper came out in 2022 looking at patients who had post-COVID syndrome. And in those patients, hyperbaric oxygen was associated with improvement in cognitive, psychiatric, fatigue, sleep, and pain symptoms of patients with post-COVID. There was also documented improvement in the blood perfusion via MRI of multiple parts of the brain associated with those symptoms, including the supramarginal gyrus, supplementary motor area, insula, and precentral gyrus. I'm Dr. Craig Tanio with Rezilir Health, and I appreciate your time today. If you have any further questions about this video, just reach out to us at 1-866-REZILIR or on our website at www.rezilirhealth.com. We look forward to treating you. Thank you.